I'm Dr. Tina Marcantel. I'd like to talk about food sensitivity. I have patients coming in the clinic with a presentation of unusual aches and pains, and sometimes it's respiratory problems like asthma, chronic bronchitis. Along with that, they may have abdominal bloating with diarrhea or constipation. I also see unusual skin conditions, eczema, different types of dermatitis, and sinusitis. So we're seeing all these different presentations here, but they're happening more frequently now. So what we look at here is a condition called leaky gut. And, you may ask, what is leaky gut? So we have a sensitivity to certain foods, and our gut gets inflamed, and it starts actually leaking its contents. So imagine the gut getting inflamed, and then it gets kind of porous, and those things that are inside of the gut leak out into a sterile environment of the blood. And of course, as you know, the blood travels all over the body, giving us all these different symptoms. So in essence, the mucosal barrier of the gut becomes very porous, and there's a passage of unwanted substances out of the gut into the body, and thus we have the signs and symptoms. What we do is we do a food sensitivity panel. Okay, so food sensitivity is different from an allergic, food allergies, okay, an allergic reaction. When we have an allergic reaction, usually it happens that day and you'll know it. Oh, I ate this, Dr. Marcantel, and I noticed that I broke out, okay? My skin broke out, or I started coughing. All right, so these are more allergic reactions. We're looking at sensitivities to food. That means it's a delayed reaction. You can actually eat something on Saturday, and 4, 5, 6 days later, you could have the delayed reaction. So the only way we can detect that is doing a food sensitivity. And it's a simple blood test. What we do is we use the blood to check 100 or more different kind of foods. And it comes out, the results come out it's about 5 or 6 pages long. It's very in-depth, and they give you a rotation meal plan with it. But what I like about it is they give you, they break it down to let you know if the food is severe, moderate, mild, or acceptable. And that is how much inflammation with each food. That shows us how much inflammation with each food according to these different categories. So it really goes into depth about it. And, I tell patients also that the food could be actually nutritious that you may have a sensitivity to. Could be, different things, carrots or onions or stuff like that are really nutritious, but for one reason or another, your body is responding to it, reacting to it with inflammation and causing these symptoms. I used to eat almonds, like in between patients. I'd see a patient here, I'd eat a few almonds and go see the next patient. It was something quick, but I was eating it too much, and it seems like it was I was getting inflamed with it. And sure enough, it was in my severe category when I did this food sensitivity test. What is the treatment? Okay, of course, we remove those foods for at least 3 to 6 months, depending if they're moderate or severe. And then we heal the gut with supplements that will actually close those porous areas, those gaps that we have in our gut, so we don't have that flow of substances out of the gut into the blood. And we always reestablish a good gut flora. Thank you for being here with me today. And if you want more information or want to see more of our videos or audios or articles on this particular subject or other subjects, just go to drmarcantel.com. Thank you.